Greetings and welcome to our webinar on introducing SAMHSA's CCBHC Toolkit for engaging service members, veterans, and their families. I have the pleasure of introducing our moderator, Ms. Stacy Owens. Ms. Owens is the Military and Veteran Affairs Liaison for SAMHSA. She's honored to have the opportunity to facilitate collaborative efforts to improve the mental health of our nation's service members, veterans, and their families. Prior to joining SAMHSA, she served the SMVF population as a clinical social worker at VA and DoD. She earned a Master of Social Work degree from the University of Texas and a Bachelor of Social Work degree from Prairie View A&M University. She comes from a proud military family, and they are her inspiration for supporting the mental well-being of SMVF. So, without further ado, your moderator, Ms. Stacy Owens.
Thank you so much, Ms. Boudreau. And thank you to everyone who's here. We are grateful that you made time to join us this afternoon for this webinar highlighting this recently released toolkit. We have the unique experience that many of our speakers and subject matter experts who you will hear from today were directly involved in creation of this toolkit with their subject matter lens on CCBHCs. So we thank you all for being here today, and thanks in advance to our presenters and subject matter experts who will share their knowledge with us during our time together. Next slide, please. And to kick us off, we are honored to have opening remarks from Mrs. Hope Sheppelman, who serves as a senior advisor within the Office of the Assistant Secretary at SAMHSA. In this role, Mrs. Sheppelman supports national efforts to strengthen mental health and substance use systems of care and advance prevention, treatment, and recovery initiatives. She is both an experienced healthcare provider and a veteran of the United States Navy, having served as a hospital corpsman. At SAMHSA, we benefit from Mrs. Sheppelman bringing both her professional expertise and her lived experience as she leads in this important work to support the behavioral health of the nation. Mrs. Sheppelman, the floor is yours.
Thank you. Thank you, Stacy. Good afternoon, everybody, and thank you so much for joining us today. Again, my name is Hope Sheppelman, and I am a senior advisor within the Office of the Assistant Secretary that oversees SAMHSA. Before joining SAMHSA, I spent over 3 decades in healthcare, a career that began within the United States Navy, and later I became a critical care nurse practitioner working in trauma ICUs, and I cared for patients and families during the most difficult times in their lives. Through both my military and healthcare career, I have seen firsthand challenges with our service members, our veterans, families that face trauma, mental health struggles, addiction, and transition and isolation. I am also a person in long-term recovery from alcoholism. Recovery is not just something that I advocate professionally. It is something I live with every day. As a Navy veteran and as a critical care nurse practitioner, a person in recovery from substance abuse disorder that works deeply in this industry, this is personal to me. As a person in my profession and professionally, I have experienced a lot with giving the understanding on how important this work is, the support and connection and treatment with dignity for our military. I also understand the critical role the community-based services can play for our service members, our veterans, and families navigating mental health challenges, substance abuse and use, trauma, and transitioning back into civilian life. This is why SAMHSA is proud to support the release of Engaging Service Members, Veterans, and Families, a toolkit for certified community behavioral health clinics. This toolkit strongly aligns with SAMHSA's priorities around expanding access to mental health and substance abuse treatment, advocating recovery-oriented systems of care, strengthening the behavioral health work, and ensuring communities have the tools to provide high quality and personal centered support. CCBHCs are centered to this vision. Across the country, CCBHCs are helping transform behavioral health by providing coordinated, comprehensive service regardless of somebody's ability to pay or where they live. For military connected populations, this kind of access and coordination can make a real difference. While today's webinar is focused on CCBHC's model, most of this information in this toolkit is relevant to all behavioral health providers who want to improve the services for the members, active military, veterans, and families. The approaches discussed today tailor approaches to dignity, engagement, and better serve those who have served us. We can strengthen service across many different behavioral health settings. Service members, veterans, and families often face unique experiences and can affect behavioral health and recovery. These experiences may include combat exposure, frequent relocation, long separation from family, transition from military to civilian life, traumatic brain injury, substance use challenges, or difficulty navigating the multi-system care that we have in our VA system. At the same time, military connection individuals bring tremendous resilience, leadership, and discipline, and community commitments. This toolkit helps provide us the understanding both challenges and strengths within those populations. One of the most important themes throughout this toolkit is the need to identify military connection clients early and intimately. Many veterans or family members may never mention their military connection unless they are asked directly. This toolkit provides practical strategies for creating welcoming environments and improving engagements so clinics can better recognize the support those individuals and families. The toolkit also emphasizes workforce development and training. It highlights the importance of helping clinicians and staff better understand military culture, experience, so they can provide more reasonable and effective care. This includes trainings around issues like PTSD, suicide prevention, substance use disorder, trauma, and military transition experience. Another major focus is partnership with care coordinators. CCBHC cannot do this work alone. The toolkit engages stronger collaboration with VA medical centers, TRICARE networks, veteran serving organizations, peer support programs, and community partners. Those partnerships help ensure smoother referrals, better community care, and stronger support system within our veterans and family members. Importantly, this toolkit also recognizes the recovery happens and connections within our communities. It also addresses the broader life and circumstances that affect wellness, including housing, environment, employment, financial stress, and legal issues, and social connections. These factors are critical to long-term recovery and stability. This toolkit also is a practical, action-oriented. It addresses the guidelines and background information. It also has fact sheets, ideas and actions. It inspires and it examples for CCBHCs along the work that is successful within our communities across the country. Ultimately, this toolkit reflects a simple but important goal: ensuring that people who have served this country and their families who support them can access compassionate, high quality health care and behavioral care within our own communities. I want to thank everybody who has been involved in this effort, and thank you for joining us in this effort. And again, thank you. And with that, it is my pleasure to turn over to today's presenters. Thank you.
Thank you so much, Mrs. Sheppelman. We so appreciate your leadership and your support in this space. Next slide, please. So before we begin, I'd like to just highlight the subject matter experts and presenters who you'll hear from today. We have joining us Mr. David Devorney, who serves as Director of the Division of Community Behavioral Health within SAMHSA's Center for Mental Health Services. We have Dwayne France, who serves as Co-Director of SAMHSA's Service Members, Veterans, and Their Families Technical Assistance Center. Next slide. And from the community and state level, we have Kayla Pratt and Chrissy Waddips, who are joining us from Community Fairbanks Behavioral Health, which is a CCBHC within Indiana. And next slide. As well as partners from the state of Texas. We have Sarah Malecki and Paul Theobald. Sarah works within the Behavioral Health Strategic Integration Program, and Paul works within the Office of Veteran Services, both within Texas Health and Human Services Commission. Next slide, please. Before we begin, please note that the views, opinions, and content expressed in these presentations may not necessarily reflect the views, opinions, or policies of SAMHSA or HHS. Next slide, please. This webinar is being hosted by SAMHSA's Service Members, Veterans, and Their Families Technical Assistance Center. We call that SMVF TA Center for short. The center partners with states, territories, and communities to increase behavioral health support for the SMVF community. SAMHSA and HHS lead efforts to ensure that mental health and substance use treatment needs of all Americans are understood, including the needs of the SMVF community. Next slide, please. You can learn more about the SMVF TA Center by using the QR code that you see here and by visiting the website. In summary, the center supports states, territories, and communities by monitoring evolving behavioral health trends related to the SMVF community, providing TA training and consultation, supporting implementation of best and promising practices for SMVF behavioral health, providing access to experts in the field, like the experts who you'll hear from today, supporting the work of interagency teams, and supporting the training of SAMHSA grantees and others doing this important work across the nation within the behavioral health field. Next slide, please. The TA Center provides that technical assistance through academies and workshops, through national webinars like this one, through learning community sessions, technical assistance calls, and resource dissemination. Next slide, please. Our learning objectives for you today include the following: describe the purpose and structure of SAMHSA's CCBHC Toolkit for engaging SMVF, identify strategies outlined within the toolkit for recognizing and engaging SMVF within community-based behavioral health settings, understanding important considerations related to military and veteran experiences that may influence care and engagement, and lastly, recognizing opportunities to strengthen partnerships and coordination among CCBHCs, veteran serving organizations, as well as other community partners. Next slide, please. Our first speaker who you will hear from today is Dwayne France, who serves as the co-director of SAMHSA's SMVF TA Center. Mr. France is a retired Army non-commissioned officer. He's a combat veteran and a licensed professional counselor. In his role at the TA Center, he oversees nationwide TA efforts, including all of the SMVF TA Center initiatives that you just heard about. He works with federal partners, national experts, and state and local communities to strengthen behavioral health for SMVF. Mr. France, the floor is yours.
Thank you very much, Ms. Owens, and thank you, Ms. Sheppelman, for that outstanding introduction. Next slide, please. Really excited to be able to share this resource with everyone here. This resource is a culmination of a number of different partnerships that have been going on for the past several years. So my section is really going to be talking about the toolkit itself. You'll see on this slide and on subsequent slides, there's a QR code. I've also dropped a link in the chat that is available for the attendees to be able to review. And this is really to allow you to access the toolkit and be able to take advantage of some of the resources that are available. I'd like to start off with giving a little bit of an overview of the toolkit. Next slide, please. So the toolkit has a number of different elements to it. There's 4 different modules we'll talk about in a minute. And each of the modules we'll talk about 4 different areas. Insights from experts, some of which are joining us on this webinar. Notes from the field, which are CCBHCs in practice, also again joining us a little bit later on this webinar. Ideas for action, so almost a checklist, for example, of things that CCBHCs can use to be able to implement some of the ideas in this toolkit. And then resources pertaining to that particular module. Next slide, please. As I mentioned, we were pleased to be able to partner with a number of certified community behavioral health clinics and some of our colleagues here who had direct input on sharing their elements, sharing their aspects of serving service members, veterans, and their families. Community Counseling Center, Ashtabula, Ohio, Volunteers of America, Massachusetts, High Plains Mental Health Center out of Hayes, Kansas, Valley Healthcare System, Morgantown, West Virginia, Community Fairbanks Behavioral Health, who you will hear from here in a minute, Burke's Counseling Center in Reading, Pennsylvania, and then Family Service of Rhode Island. So we believe that this really gives us a broad range of different types of certified community behavioral health clinics serving urban populations and more rural populations, and how they are implementing some of these aspects even before the toolkit came out. Next slide. We also had a number of subject matter experts that we were able to engage to provide input and insight on some of these things. And so these range from individuals with lived experience themselves, individuals who support service members, veterans, families, and certified community behavioral health clinics, but also partners from the Departments of Veterans Affairs to be able to give that perspective. And so definitely want to appreciate everyone's insight and input, which is really what helped this toolkit be as successful as we believe it can be. Next slide. So now I'd like to go over each of the 4 modules. This is a little bit of about a 130-page toolkit, so we're not going to have time to go through everything today, but this will give you an idea about some of the things that you can see in the toolkit and might be able to benefit you and those that you serve. So the first module is really on identifying service members, veterans, and their families. And we at the TA Center and across the country recommend that we identify that by asking the question, have you or a loved one ever served in the military? Next slide. So in this module, we talk about how to ask that question, specifically to address how some individuals who serve in the military don't consider themselves veterans or may not want to identify themselves as veterans. But really beyond that, how do you then start exploring the background of someone once they say, yes, we do, and my family member, myself, I did serve in the military. So how might we engage that individual, explore their background, and then really to identify their needs? What are some of the unique needs that would show up in the military and veteran population in a certified community behavioral health clinic? Next slide. Again, as you will see, we have these different elements that you'll see across all of these modules. So from this module, Notes from the Field talks about developing a centralized and specialized intake process for those who served and those who care for them, a dedicated peer and support staff, focused training and outreach, and then coordinated and local partnerships. And then insights from experts. Again, our SMEs really gave some very generous and very in-depth insights that you will see. Things like why veterans have how to help veterans overcome a hesitation to share, some insights on SMVF specific intake and safety planning, adaptable identification strategies, and then really leveraging lived experience in staff. Next slide. We also have, as was mentioned, the ideas for action in the toolkit. Each of these are explained a little bit more, but this is, again, almost a checklist of how CCBHCs can employ some of the concepts in this module and toolkit. How to train staff on asking the question, developing a referral system for support services, and really just how to promote awareness of SMVF programs. If a CCBHC does provide SMVF programs, but you don't have a lot of veterans and family members in your client population, how do you promote that more? And then again, we have hyperlinks for all these resources, things like the New Hampshire Ask the Question website, Arizona Coalition for Military Families Risk Reduction Framework, Maine's Veteran Suicide Prevention Toolkit, which has a really excellent sort of workflow, a framework of if an individual does identify as this population, what next? And so again, these resources, this is in the PDF. These are clickable resources that can take you to these websites and these resources to be able to support you in implementing these in your CCBHC. Next slide. Module 2 is really about military and veteran experience. And so understanding military and veteran experiences, there's not enough veterans who are in the clinical field. So individuals who do not have a military and veteran background could really benefit from learning more about military and veteran experiences to better support them. Next slide. Again, this module identifies the need and the responsibility to become more aware of military service and how to be responsive to that. Different aspects of military and veteran experiences, things like veterans of different eras and different conflicts, veterans of different age, different values, military values. And then really understanding the access to care and eligibility for benefits. So understanding that there are some very specific needs when it comes to accessing care and how veterans might access care and why they might be eligible for benefits or not, as the case may be. Next slide. In this section, notes from the field really talk about investing veteran program staff, investing in veteran program staff with lived experience, providing continuous training on military and veteran experiences, and then really helping individuals who hadn't served understand about discharge, the differences in discharges and disability upgrades. The insights from experts, some of our experts shared things on how to address sometimes discharge status, really understanding military culture, the humor, the camaraderie, recognizing the influence of rank and even the branch of service on the veteran in their post-military life and the family member, and then really understanding how to deliver responsive person-centered engagement. Next slide. In the ideas for action in this module really talks about, again, the need to provide and take specialized training on military and veteran experiences, how to enhance visual representation, that when a service member or veteran comes into a CCBHC that they feel like they might belong there, or this is a place that they are welcome. Peer support is really, really valuable when it comes to service members, veterans, and their families, and then how to collaborate with veterans organizations. And again, some resources to address some of these things, like Psych Armor. The Worried About a Veteran website is an excellent resource that helps family members talk about how to have conversations around lethal means safety. Military and Government Counseling Association has a list of exemplary practices. Nevada has a military pocket card. Utah has a military playbook. And then there are community toolkits for safe firearm storage. So again, these resources are available for you if this is an area in which your CCBHC you believe could benefit from. Next slide. The third module is really about key partnerships for service members, veterans, and their family support. And here we talk about three specific areas, definitely the Veterans Health Administration and the Department of War's Defense Health Agency. Those are definitely two federal organizations that CCBHCs can partner with, and as well as a wide range of veteran serving organizations. You can see some of the logos there and how you might, as a CCBHC, engage with veteran service or veteran serving organizations, or even military service organizations, to be able to enhance the support for your military and veteran clients. Next slide. In this module, we will really do, again, talk about the Department of Veterans Affairs. So how to partner with the Department of Veterans Affairs. Specifically in this module, some people say that it is the benefit of the entire toolkit is we actually provide some examples of some memorandums of understanding from some of the CCBHCs, but also one of them was developed by the Department of Veterans Affairs Medical Center in Kansas to be able to be used with CCBHCs in their state. So there are 3 or 4 examples of memorandums of understanding about partnering with the Department of Veterans Affairs, as well as the Department of War, partnering with becoming TRICARE providers or a military one-source provider, and how if you are serving in a community outside or near a military installation, you likely have military family members within your population. So how you might engage with the Department of War, partner with the Department of War, and then partnering with veterans serving and veteran service organizations, again, to enhance your ability to support those who served and those who care for them. Next slide. In this section's notes from the field, we talk about having a specialized, still continue to have the specialized intake process and really engaging with some of the partnerships, and then partnering with VA programs like M2VA, and ensuring that the military to veterans, the M2VA, the M2VA program, and how to use MOUs, shadow staff to provide referral processes, and then embed clinicians in trusted veteran organizations. So how to partner with some of these veteran organizations to be able to provide clinical support where they may provide a different kind of support. Next slide. Here, ideas for action: establishing partnership agreements with the DOW, with the Department of Veterans Affairs, joining community care networks. In many ways, that's a way that the federal agencies partner with community level agencies, and how to engage with local veteran organizations and participate in community collaboratives. Some of the resources here really talking about the TRICARE network providers, VA SAMHSA Governor's Challenge, which is yet another program from the SMVF TA Center that we support, the Department of Veterans Affairs Office of Suicide Prevention and SAMHSA in coordinating, and things like the National Resource Directory, finding veteran serving organizations within your locations and community. Next slide. And then finally, the 4th module is really on what some of the unique clinical considerations and life circumstances that service members, veterans, and their families might experience. Really, this is broken up into biopsychosocial conditions. So CCBHCs, clinicians who work in CCBHCs will likely see these things like traumatic brain injury, post-traumatic stress disorder, substance use concerns and addiction, as well as things like moral injury and needs fulfillment, and how important purpose and meaning is to post-military life. And then this section also talks about life circumstances. So these are situations that are not necessarily clinical, but definitely have an impact on our mental health and well-being, such as chronic medical conditions, housing and financial instability, and really talking about the risk for suicidality, isolation, perceived burdensomeness, and access to lethal means. Next slide. In this module, we do talk about the common clinical concerns, so things like, again, PTSD, TBI, substance use concerns, but also some broader issues such as purpose and meaning, family concerns. Our mental health impacts our family, and our family impacts our mental health, as do our social considerations. As well as things like transition stress. So understanding that transition stress might have some elements that are unique to service members, veterans, and their families. And then really talking more about the life circumstances and the community concerns, and how to support connection, reduce isolation, and ensuring access to services aligned with their needs. Next slide. Notes from the field. So our CCBHCs really talk about how they implement biopsychosocial assessments that integrates health and stressors. There's a lot of alignment with the VA's whole health model, which guides personalized pain management, and then how veterans can benefit from emotional regulation support. Our experts have really identified the benefit of using the biopsychosocial report, and then how the VA's whole health model, again, outreach events, reducing stigma, improving engagement, and then using screening tools to identify particular needs. Next slide. Again, ideas for action. This section really talks about how to create inclusive treatment and safety plans, comprehensive screening protocols. Case management can be very important as clinicians are working with clinical aspects of the veteran's care and working with the case manager to engage with some of those life circumstances, conditions. And again, a number of different resources. STAR Behavioral Health Providers Training Program and the Strong STAR Training Initiatives are two excellent programs that will support the development of not just military experience training, but also very specifically some clinical training on some of the unique needs, such as post-traumatic stress disorder, traumatic brain injury, but also some resources for life circumstances like National Veterans Financial Resource Center, FinVet by the VA, and Supportive Service for Veteran Families, which supports veteran housing. So again, the toolkit provides a number of different resources for you to be able to develop some of these aspects in your CCBHC. Next slide. And so again, I think I just ran through maybe about 15 minutes and just give you a very brief overview of the 4 different modules and different elements within this toolkit. As was mentioned, there are fact sheets that summarize this. You can tear those out. You can use the toolkit in the modules to be able to identify if you just want to focus on clinical considerations and life circumstances. Again, focus on module 4. If you're really looking key partnerships, focus on module 2. So these are the different aspects of the toolkit. And I'm really excited to hear how my fellow presenters are really taking this toolkit and applying it and bringing some of these elements to life. And so with that, I will turn it over to Stacy.
Thanks so much, Dwayne. We really appreciate you giving us a Cliff Notes version of the toolkit, introducing folks to the modules and some of those resources within. Also, thank you for putting the link in the chat for the toolkit, for the full toolkit, so that folks can dive into more details and check that out for themselves. Next slide, please. And to talk a little bit more about where the rubber meets the road within CCBHCs, we're grateful to have Christy Waddups and Kayla Pritt from Community Fairbanks Behavioral Health, which is a CCBHC within Indiana. Kayla has worked there for more than 10 years at Community Fairbanks Behavioral Health as a recovery clinician, state hospital liaison, program manager, as well as psychiatric rehabilitation program manager, before she advanced to her current position as the project director for the program's CCBHC grant. In this role, she focuses on strengthening the program to meet CCBHC standards, as well as meeting the needs of clients served. Outside of Kayla's professional work, she's a proud mom of 2 and a military spouse, giving her both a personal and professional appreciation for the unique needs of SMVF. She'll present alongside Christy Waddups, who's a CCBHC grant administrator within Community Fairbanks Behavioral Health, where she's worked in community mental health for over 22 years and joined Community Fairbanks Behavioral Health about 4 years ago. Through her career, she's worked in several areas of behavioral health with a passion for program development. This work within the CCBHC on improving service for veterans has been especially impactful for Ms. Waddups, who is an Army brat, and her work is inspired in memory of her father. Ms. Pritt and Ms. Waddups, the floor is yours.
Thank you. All right. All right, ready for the next slide. Hi there. Okay, So I'm Chrissy Waddups, and I'm here with Community Health Network. We are a hospital system in Indiana. So next slide. All right. So within Community Health Network hospital system, we have two community mental health centers. First is our Community Fairbanks Behavioral Health, our main bigger area, which is in Indianapolis. That grant focuses, the CCBHC grant we have there focuses on Marion County and is predominantly within urban setting. Kayla, who is here with me today, is our project director and grant administrator, specifically focused for that area. And our other community mental health center is Community Fairbanks Behavioral Health Howard, and that is up north of Indianapolis with Kokomo-Tipton areas. And that grant is mostly focused on Howard County. And again, it's kind of a smaller mid-sized city and then surrounding with rural areas. And I am that project director and I do the grant administration for that. So within our network, we really operate as trying to have our programs unified, training everybody with a core set foundation, and then making modifications as needed per whatever area they may need. All right, so our next slide. All right, and I'll go ahead and Kayla will get us started on this.
Yes, hi everyone. So when we first started our CCBHC grant and reviewing the CCBHC criteria, we really felt that we needed someone on the team really just dedicated, to just all things veterans and families. So this led us to hire our veteran care coordinator in November of 23. So he actually serves as a central point of contact for our veterans, families, and also treatment teams. Also the veteran care coordinator role. So it's really focused on building strong community partnerships to better serve our veterans, identify training opportunities for our organization, receive referrals, conducts outreach, also increasing awareness of the services that we provide to ensure that our veterans get connected to the support that they need. And yes, next slide, please. Great, thank you. So we focus both on our current behavioral health clients within our network, but then also veterans in the community who may not yet be connected to services. So referrals come from different areas. They come from our inpatient hospital within our larger network, crisis, also community partners, caregivers, so serving clients at our outpatient clinics. Also, that has expanded to our primary care clinics. Our veteran care coordinator can receive referrals from our primary care as well, and then the VA. So talking through the current clients already in our healthcare system, we utilize the military service question that is built into the AMHSA assessment to identify the veterans within our system. So our veteran care coordinator actually worked with our IT department to build this report, and it is ran weekly to show who answered yes to ever serving in the military on the AMHSA. So then once identified in that report, our veteran care coordinator connects with that client's treatment team to see if there's any needs or if he can provide additional support. And then he obviously will do so if that is acceptable or wanted by the veteran. So through this outreach process, we're able to connect with the veterans, families if needed, to provide resources or services that they may not have known even existed. And next slide, please. And Chrissy.
Thanks. All right, so when we were looking at the program, we really looked at what are some things that can be the most beneficial. So there was a big focus with CCBHC on peers, and we were very fortunate for our veterans care coordinator that we hired in, that he is a veteran and is able to really give us that peer focus with our coordination. So we made sure there was peer involvement with developing trainings. We wanted to make sure that he had a role in reviewing that and really narrowing down which trainings we selected, and also giving his feedback on kind of why he preferred one training over another. And so it really just became a very collaborative process to make sure that all of our directors and program leadership were all involved, so that way they could let our staff and direct care providers know about this new service that we were being able to offer. All right, so next slide. So this is just kind of some of the specifics that we had. So our peer, our veteran care coordinator, again, we were fortunate. He had 20 years of active service before joining us. And so we were able to hire him on. We weren't necessarily specifically looking at a peer, but however, with having a peer serve in that role, we found that that was extremely beneficial to making our program successful. He was able to review training, so we looked at things like getting connected with the VA SAVE training. There's the Military Family Research Institute at Purdue that has STAR training, free STAR training for therapists, licensed clinicians. We also made sure our coordinator was participating in his own training to make sure he had the support he needed. Different conferences and webinars that were around, just finding what was already open and available in Indiana and getting him involved and connected. Also to kind of network a little bit and find out what is available and out there already for our veterans and what is needed, that might be a gap in services. And then also we looked at stand down events, which are local events held in many counties. And this one focuses in on, food, clothing, shelter, what kind of treatment and services that our veterans, especially those that are dealing with housing issues and are at high risk, how to get them connected. And really that was a wonderful way to be able to connect to the community and make sure that we are understanding what the veteran need is. All right, next slide.
So strong partnerships, we feel that were essential to serving veterans effectively. So to promote the services that we are providing, we started with creating a veteran brochure, which we were able to lay out all the services that we provide and also how to reach our veteran care coordinator to get started with those services, or even just to learn more and have those conversations with him. We also sent these brochures by email to everyone in our network, sent them to our external partners. Also, we had them printed the brochures and put them in a lot of our primary care offices. Other ways we kind of got the word out was highlighting the services in monthly newsletters internally. We have our CCBHC grant website, and we felt that that really made the services known, and we were trying to get, the word out there. So spreading the word, building the partnerships by engaging within our community, and we'll talk more about that too, I believe, on the next slide. And increasing the provider availability really allowed us to provide more comprehensive support and improve that continuity of care for veterans. Next slide, please. Okay, so here is a table of just the key partnerships we were able to engage in and build over the last few years. It was a wide range of organizations. So these relationships really started to blossom just from attending events and our coordinator doing the work. So working with the veterans and on the needs that they have. So our veteran care coordinator, just to highlight a few, is part of the actual veteran court team in Howard County and Marion County. So he actually sits in and is able to accept referrals, get them connected to behavioral health services if that's what's needed. And then Chrissy touched on our participation in standout events. That has really been a great thing. It's allowed us to reach veterans who maybe not otherwise engaged in behavioral health services, and also to network there and build partnerships. So again, we feel that the success of this veteran program that we have is largely driven by the partnerships and just that shared commitment to supporting veterans and their families. Next slide, please.
All right. So when thinking about clinical factors, and even just life circumstances, we really wanted to make sure the trainings we had were specific for the need. So we did pick a Relias training that we felt was really good at covering several areas of kind of introducing, military culture. And we have our staff now complete upon orientation at new hire and then annual trainings to make sure that that stays fresh and kind of that reminder's there. Our coordinator is also able to create program specific presentations as needed. We are very fortunate within our network to have our Linda McLean Institute, which does provide a lot of evidence-based training and a career ladder. And so our veterans coordinator had been able to work with them on making sure the training that is specific to veterans, a military life, family needs, that all of those are incorporated as part of our training institute. I know not every agency is quite big enough to have those of their own, but we have seen, even through different conferences we've been attending, more and more places that are offering those types of services to make sure that there are some really good evidence-based trainings available for staff and clinicians that you have. We focus on those partnerships with community services to find out, not only what others already have and are addressing the needs, but also to be able to learn from them. Many of them have been in the community for several years and have already figured out a lot of things that we needed to learn. And by working with them and developing that relationship, they really were able to assist us just as much as we were able to offer help by providing behavioral health treatment for referred clients. And then the veteran coordinator also, works with the direct care team to make sure that those life circumstances that might be outside of behavioral health are being addressed. So one of our partnerships is with housing. We have another one with Work One. So he's able to address maybe with the treatment team, all right, we've got the behavioral health services going, and then he can talk with his contacts with Work One or with housing to address some of those other life circumstances. So that has been very beneficial for us. All right, next slide. All right. And so these are just some of our outcomes that we've started to see in these first couple of years, things that we've learned. So for internal and external referrals, our first year of tracking, once we really had the program developed and started publicly announcing and passing out our brochures, we had 15 total, 11 were internal, 4 external, and then we were able to participate in 2 stand downs. By 25, we had, dramatically increased, especially our external referrals. So we had sustained, continuing to have internal referrals and increased external referrals to 12. And then again, increased our stand downs to additional counties. And we were excited to be invited back to the counties that we had been at in the previous year. And so another benefit that we have seen from it is just that our veteran coordinator is getting way too busy. He's managing multiple things and multiple areas, and we're excited to see that growth that can continue to develop into further coordinators or maybe even, full-time staff in each location versus one that is kind of spread out helping. But ways we make sure we stay updated is giving those updates to our leadership at monthly meetings, letting them know what's going on. We want to make sure our patient and family advisory council, which is part of our governance, to make sure that we have those with lived experience involved. We report to them, and that's bi-monthly. And then our veterans coordinator was able to deliver trainings to 11 different locations that we have. And then he's really, like Kayla had said, established a lot of different partnerships that we've been able to really kind of branch out from. Usually once you've connected with one and they see that here's what you're able to offer and here's how you're able to support, and then we find that we can work together, then okay, here's another, and it really has been wonderful to see the community come together. So as part of the grant, we just keep to our plan, do, study, act, figure out what's working and adopt it, what needs changed and adapt it, and then what's not working and abandon it. And then just keep repeating the cycle while we keep improving our program. All right. Oh, next slide.
Yes, thank you. So just to close, so building these systems and partnerships, we've been able to create stronger pathways to care, and then are also able to better support the veterans and families that we serve. So there's just some photos from us and our team, and thank you all for having us. I'll toss that back to Stacy.
Thank you so much, Chrissy and Kayla. You shared a lot of things that clearly resonated with your counterparts who are on the call here. Lots of questions about the veteran care coordinator role. You all really speaking to the power of peers. Was really important, and your partnerships. And I love that you kind of closed out your portion of the talk by discussing Plan, Do, Study, Act, that approach to ongoing evaluation and how important that is as you carry forward efforts and leave some efforts and develop new efforts through that process. So thank you so much. We will leave a few minutes for Q&A at the end for the audience, where we expect that our presenters will be able to answer a few of your questions live. And as you see, you've also been getting some questions answered through the Q&A pod throughout the presentations as well. So next, we will hear from a state perspective in the approach to supporting CCBHCs. You can go to the next slide, please. We will hear from colleagues in Texas who focus at the state level on serving veterans within Texas's CCBHCs. The two speakers for this portion will be Sarah Malecki and Paul Theobald. Ms. Malecki serves as the Director of System Integration for Texas Health and Human Services Commission. She's served as the Deputy Associate Commissioner of Behavioral Health, Integration and Innovation. Prior to this position, she worked directly in programs related to Texas Medicaid and CHIP policy. And she really focuses on that policy arm of serving consumers. She holds a bachelor's degree of arts and political science and a master of public affairs, which really gives her a holistic lens to her state level work with CCBHCs. She'll be co-presenting alongside Paul Theobald, who serves as the Senior Advisor within the Office of Veterans Services for the Texas Health and Human Services Commission. Paul is a U.S. Navy submarine vet with 15 years of experience in military and veteran policy at the state level. He's served in senior leadership roles in the Texas House of Representatives, where he's focused on legislation oversight and budget issues impacting service members and veterans. And at the Texas Health and Human Services Commission, he managed statewide contracts for veteran mental health services, and his current work integrates policy development, technical assistance, and state coordination to improve outcomes for SMVF. Ms. Malecki and Mr. Theobald, the floor is yours.
Thank you so much. Next slide, please. We really appreciate the opportunity to be here and chat with y'all this afternoon. Texas, as I think everyone knows, we have a lot of military bases here in this state. We also have a lot of veterans, military families, and also VA facilities. We are also home to 42 Texas CCBHCs that are certified by our agency, and they cover the entire state. And our CCBHCs are proud to provide support to those who have served and their family members. Next slide. As you can see, just a little bit of our agenda for the day, we're going to discuss some of the efforts that Texas has made throughout the state, and then how those align with the new toolkit that we were lucky enough to provide some input on. I'm going to pass it over to Paul for the next slide.
Okay, thanks, Sarah. So what initially drove this work was a combination of urgent need and identified system gaps. As all of you probably know, we've had an epidemic of suicide amongst our veterans in the country, in Texas specifically. And we noticed in Texas that veterans were dying by suicide even in the parking lots of VAs. So we felt like something had to do, but we realized that the systems were largely disconnected. In 2018, Texas was invited to participate in the Governor's Challenge to Prevent Veteran Suicides, which helped focus our efforts. Initially, we focused on crisis intervention, making sure that there's pathways from VA facilities to nearby community resources and from nearby community resources to VA facilities. But what we realized pretty quickly is that crisis intervention isn't enough. We need to go upstream. And if we're only gauging veterans, SMVF at the point of crisis, then we've probably already missed opportunities to intervene. So that insight led to our broader efforts, including tools to better identify veterans in community settings, not just when they present in crisis, but before then, and also to standardize how we ID these SMVF. Next slide, please. So we conducted a landscape analysis to better understand the system we are working within. First, we did an internal review of health and human services programs. Then we did mapping of the VA systems across Texas and examined the community-based organizations involved in behavioral health. In doing that, we identified a couple key barriers. One of the most common and widespread across Texas from different polls and surveys and feedback reports, everything is veterans, SMVF, and providers don't know what veterans are eligible for, and they don't know where to find it. And so that's something that we identified, and then we also identified that there were significant gaps between the VA and community providers. And as was referenced by Dwayne early in the presentation here, we also identified transitions as being key high-risk periods for veterans. Transitions could be discharge from service or even transition from one place of care to the other. And using this landscape analysis, we also looked for promising practices, and you'll see those reflected in the toolkit. But some of those practices that we saw was that providers understanding the military experience provide better service. Local crisis care agreements help plug those continuity gaps, and so we worked to do a template that kind of helped establish an agreement between VA and other CCBHCs. Next slide. So once we identified some of our problems, promising practices, et cetera, we looked for partners. It involves finding more than just organizations to be involved, but also finding the right people within those organizations. Key partners include suicide prevention specialists, your outreach specialists, in specifically working with CCBHCs and VAs. You have your CEOs of the CCBHCs and your medical directors of VA medical centers. But something that we learned, and I'd like to pass on to all of y'all, is, again, never take no from someone not authorized to say yes. So get those right people involved, get people that are decision makers that can help. Otherwise, it really does gum up the works. I kind of mentioned a little MOU earlier. What we found worked for us is MOUs between VA medical centers and CCBHCs. They're non-financial, but they represent an agreement that the two entities recognize the deadly gap of transitions and are working to close that. Sarah?
Yeah, our TCCBHC partners they are partnering with lots of different levels in the VA system. So some of them are just the VA healthcare systems more broadly, of which we have several here in Texas, VA medical centers, veteran centers, community-based outpatient clinics as well. And then we also have those who are partnering with local veteran services organizations that are not part of the VA system. It's pretty common for counties, for example, to have veteran serving organizations. Next slide.
Yeah. So once partners were identified, right, then comes the engagement. That's a critical next step. Often it starts with one-on-one meetings. We've had broader stakeholder meetings where we bring everybody together. But the core principle here is establishing trust. Particularly when you're working with service members, veterans, and their families. Understanding the military experience is so important for providers, because I'm a veteran myself, and I know a question that many, if not all, veterans consciously or unconsciously ask themselves when they're talking to a provider is, can I trust you? Do you know what you're talking about? Do you know what I'm talking about? So understanding the military experience is key, and that requires building that trust, and you need to have clarity, consistency, understanding, and respect for the military experience. Sarah?
Yeah, with engagement, some of the things that we found that have been incredibly important, and I don't think these will come as a surprise because this is important for both veteran serving organizations and others, but the first being listening for their needs and concerns. And veteran serving organizations are going to have some specific needs and concerns that they want to work through, and CCBHCs as well will have some specific ones. Also establishing that preventing veteran suicide is the shared outcome. Again, having that shared goal in mind and working towards that goal is a lot better than coming together and just saying, hey, I'm a CCBHC and I'm supposed to have an MOU with you. You need to understand the why. Finally, thinking about continuity of care practices, engagement tactics, some of those things may differ for SMVF clients. And so thinking about that is very important as you're developing those partnerships and putting your agreements together. One of the things that I've really learned from Paul and his team is the importance of how we ask questions. Those matter just as much as what the questions are. So for example, when working with a veteran, one of the things that we recommend to CCBHCs is to use the question, have you served? Because that is a broad question that allows that veteran to determine, what branch was I in, and they're all included. Some folks may think that their branch, or if they're a Texas military versus federal, we still want to know all of that. So we want to have those broad questions. Next slide. So of course, within these processes, there are challenges and solutions. I'll talk about some of the challenges and then Paul will go into some solutions. One challenge is for Texas CCBHCs. They're generally not looking to become part of the VA's community care network. And so the reason for their care coordination agreements are outside of that CCN, and that can be very confusing to VA facilities because there's a question as to, why would I have this agreement with an organization that's not part of the community care network? Another challenge that our CCBHCs have worked to overcome is that TCCBHC and VA priorities, they do change over time. And in some cases, in Texas, the TCCBHCs have not been able to secure a renewal of a VA agreement at the time of expiration because there are different priorities at different times, which is understandable. We also have seen challenges in sort of where each role starts and where it stops. So for example, the legal framework is an important place to include all of these different requirements and what each of the entities is supposed to do. Thinking about that boilerplate agreement and then allowing it to be adapted by the parties as they prefer. Also looking at who needs to be at the table and how can they resolve challenges. Paul mentioned this before, but really just ensuring that those folks who are at the table are the right people, the decision makers who are there. Paul?
Yeah, so in looking at solutions, we took a multi-level approach, and something that we say here in Texas is local solutions for local problems. We have 254 counties in Texas. One of those counties, Harris County, has more people in it than I think 30 states. And one of those counties, Brewster County, is bigger than most states in New England. So we have a real diverse set of population and geography. Also, we have frontier counties, we have urban, suburban. So, really, Texas does not have a one-size-fits-all. And so we had to do a multi-leveled approach. As was referenced earlier, we look at local collaborations and coalitions. In Texas, we have an unfunded mandate for counties to have a county veteran service officer. And they provide help mostly with claims, but also with accessing services. And of course, we have our local county veteran service organizations, whether they're the legacy like VFW, DAV, American Legion, et cetera, or other of the 10,000 plus registered veteran serving organizations in Texas. They provide great local support. At the state level, what we've tried to do is work to facilitate between our state Texas Veterans Commission and the VA, and also with the services that we provide here at Health and Human Services, coordinated with services that they may be eligible for in the VA. And to kind of help that, we it started in Harris County in Houston, but we put together a template for a memorandum of understanding that we've been able to get agreed upon between several VAMCs and CCBHCs. I think we're up to 15. Don't catch me on that specifically, but quite a lot. And again, it's a non-binding, non-financial agreement that simply recognizes the deadly gap and agrees for once somebody is stabilized in one place, if they're eligible for another place, then they will be transferred there in kind of a warm handoff. And then, of course, at the federal level, we've got SAMHSA and their technical assistance and this fantastic toolkit that really does provide a lot of guidance for building infrastructure and sustainability, and works off of a lot of the challenges that we've overcome and promising practices that we've seen and everything like that. Next slide, and Sarah.
Thanks. This slide just shows a little bit about how Texas CCBHC and the TCCBHC working with the VA has evolved over the years. Our first 8 TCCBHCs were certified in 2016, bring that up to today where we've got 42 of them statewide, which is really great. As you can see today, we actually now are at 21 agreements, and so half of our TCCBHCs have agreements with some level of VA in their community, which is fantastic. I did want to note real quick one thing. In Texas, we run our model a little bit differently than the federal CCBHC model. It has been called CCBHC with a cowboy hat, which I kind of love. But in 2023, SAMHSA did update their CCBHC criteria, and that update allowed for unsigned joint protocols instead of necessarily requiring a care coordination agreement if that signed agreement cannot be obtained between the CCBHC and the VA. In Texas, we updated our criteria largely to match SAMHSA criteria, but we did make a change for this particular criteria. We maintained our previous requirement, which is that the TCCBHC is required to have a signed care coordination agreement with a VA facility. And we also have said, because that is not always possible, that our TCCBHCs must continue to attempt an agreement with a VA facility within at least 12 months before each recertification. They're recertified once every 4 years, so they need to be maintaining those relationships. Next slide. For sake of time, I'm not going to read these out, but we wanted to share a couple of success stories with you. This first one out of the Harris Center, which is our TCCBHC that, of course, first got an agreement with a VA in their locale. And this one is really an example of how an agreement can positively impact a veteran themselves. This veteran, of course, was experiencing a crisis, got connected with the Harris Center through their mobile crisis intervention team, and ended up going through several of Harris Center's services. They also, Harris Center, through care coordination agreements, was able to link them to some other community supports. And so they actually were successfully discharged from those crisis services, which is fantastic. This is a really good example of Module 4 of the toolkit, considering clinical factors and life circumstances of service members and veterans and their families. Next slide. Now we're going out to Hill Country. This is in what we call the Hill Country of Texas. So central, moving west in Texas, a lot of rural and frontier areas. And this one is in Hondo, Texas, is where we're talking about. So this is an example of how an agreement can positively impact the relationship between the CCBHC and the VA as organizations, entities. And then that in turn supports coordination at the individual veteran level. The example is, part of what strengthens care coordination, and that's outlined in Module 3 of the toolkit. So looking at those key partnerships for SMVF support. Next slide. One thing that's really important to me when I look at the CCBHC criteria is that I think a lot of folks, we think about the veteran portion of the criteria only being in criteria 4K, which is very specific to requiring CCBHCs to serve veterans. But if you look throughout the criteria, really so much of it has a direct impact on veterans, serving their families. So a few that I really wanted to point out are criteria 3C and 4D. So these require partnerships with other provider types. They also require CCBHCs to refer people with a need outside of the CCBHC's expertise to an outside specialist. So an example of this that would be common with our veteran population is those with a traumatic brain injury. They may need a specialist that is not employed by that CCBHC. So it's important that the CCBHC has those agreements in place and can get that veteran the support that they need. Also looking at criteria 3C, this requires CCBHCs to have agreements with employment services partners. This is one that I think is very important. They are very helpful for veterans who are looking for employment, as we know, especially in transitioning to civilian life. That can sometimes be an area of need. And there's also a lot of other non-medical drivers of health that can be especially helpful to veterans if our CCBHCs have those coordination agreements in place. So that includes things like veteran specialty courts, like we heard from our colleagues in Indiana, housing agencies, and other agencies of that type. The toolkit is written to operationalize all of the certification criteria for the SMVF population. So I wanted to just point out some of those that may not be as evident as criteria 4K is. And next slide, and I will send it back to Paul.
Okay, so looking ahead, some things that we kind of identified based on our challenges and solutions and our engagement with stakeholders and everything. Something that we see as a need going forward is the continued need for technical assistance on the VA system. And that goes back to At least here in Texas, one of, amongst all our surveys, feedback reports, et cetera, one of the biggest gaps is, again, both SMVF and providers do not know what SMVF are eligible for, and they don't know where to find it. And so we could use more technical assistance for both CCBHCs and organizations to understand what is available through the VA, and also in Texas, what is available through the Texas Veterans Commission that picks up where the VA does not fill, and then what else is available outside of those systems. In addition to that, technical assistance on common areas of clinical need for veterans. I saw a question earlier. You don't need to be a veteran to work with veterans. What you should be is informed on veteran issues. You should be informed about the military experience. And whether that is through training, such as mentioned earlier, there's components of psych armor that do military informed kind of what's going on with military experience. And so there's a lot of resources out there. But better understanding the military experience is really what's required to help veterans. But that extends, right, not just to providers, but also to frontline workers, people that are doing intakes, that are engaging SMVF when they walk in the door, whether at a CCBHC or other organization. And then looking forward, we see both challenges and potential opportunities with a potential consolidation of VA VISNs. We're not quite sure right now what that might look like, but as the understanding is that there's going to be a restructuring of how VISNs are set and where they cover. And so, there's challenges, but there's also going to be opportunities to look forward to. Finally, I think there's a strong potential to really scale this work through training, onboarding, and broader use of this toolkit. Next slide. Okay, with that, thank you so much for your time and attention. I want to appreciate the opportunity to present, and thank you for including us. And we're so happy to be able to not only participate in this, but help bring it to y'all. If you'd like to follow up afterwards or have any questions, our respective emails, contact emails are there on the slide. Please note that between veteran and services and between services and coordination, there is an underscore there in the email. So other than that, thank you very much.
Thank you so much, Mr. Theobald and Ms. Malecki. I like how you grounded these services and looking at urgent needs and identified system gaps and looking at those within the context of veteran suicide and those lives that have been lost and the services that we really need in order to close those gaps for veterans who need care. Thank you so much for speaking to the area of formal agreements between CCBHCs and local VAs. As you highlighted, Ms. Malecki, the CCBHC certification criteria nationally does have that encouragement for the exploration of those formal memorandums of understanding between CCBHCs and VAs, and you all sharing how you've approached that has been helpful. Mr. Theobald, you have a lot of one-liners. You said, don't accept a no from someone who's not authorized to say yes. And that's something that's going to stick in my head, especially when we're talking about this area of creating those MOUs. So we're going to transition into a little bit of time for questions. We can go to the next slide. I did want to give just kind of a quick recap on a few questions that we saw a number of times, some of which were logistical in nature. So the slides and the recording for this session. So everyone who registered for this event will receive a copy of the slides as well as the recording via email. That will be over to you all in the coming days for everyone who registered. Even for those who weren't able to make it live today, they'll receive those. For those of you who have attended, you will also be emailed a certificate of attendance documenting your attendance and participation here today. Thank you also. There were a couple of you who were really diligent about asking us to explain acronyms and explain some of the programs and terms. For those of us who work with the military veteran community, there are some things that roll off the tongue pretty easily. So appreciate attendees asking for clarification when there were programs that they were not familiar with. And you'll see that in the Q&A section. You'll see some of those answers to acronyms and some helpful links that the TA Center added there about various programs. I did want to kick off a question to my SAMHSA colleague, David Devorney. Just kind of hot off the press here recently, HHS issued a press release on CCBHC Medicaid demonstration expanding, I believe, to 10 states. So I was wondering if you wanted to share about that from your perspective and how you feel that will impact individuals needing behavioral health services in the community, especially veterans.
Thanks so much, Stacey. Yes, no, I appreciate you highlighting this. So we've been working since 2017 to develop the CCBHC initiative, and we're excited because until June, we had 21 states that were supporting 22 states that were supporting CCBHC through their Medicaid programs. We are very excited to add 10 more states that will be starting their programs as early as July 1st, 2026. Some of them are taking a little bit longer to start implementation of their programs. We're going to be adding CCBHC programs supported by Medicaid in Alaska, Colorado, Hawaii, Louisiana, Maryland, Mississippi, Montana, North Dakota, and Washington. And West Virginia already had a CCBHC program, but they're going to be moving parts of that program or that program under the CCBHC demonstration. Which will help them with their federal match, among other things. And so, we're really excited to see this expansion to additional states. This doesn't mean that every provider in the state will be a CCBHC instantly. Most states are working with a subset of their geographic areas of providers and building out their programs over time. But it does mean that, veterans, members of the armed forces and their families will be able to access care at CCBHCs with a sustainable source of support through Medicaid in those states for those CCBHCs participating. So we're really excited about that. And we're also excited because I think this is going to be a focus of technical assistance moving forward. And we have this toolkit, the learning included it as a resource to build teacher technical assistance, which I think can inform the programs in these states in addition to the existing CCBHCs and state programs that are out there.
Thank you for that, David. So important that more folks will be able to benefit from services in the community. I appreciate you sharing on that recent press release. I wanted to just kind of highlight a few questions that were asked and answered within the Q&A pod here, but hoping that the presenters might be able to share a little bit more on their thoughts. There was a great question, and this is coming to the folks from Community Fairbanks Clinic. There was a great question here about kind of EHR functionality and using various Z codes to help with identifying military service and veteran status. And I was wondering if Chrissy Waddups or Kayla Pritt might want to share a little bit more about how information is collected within your electronic health record to signal veteran status.
Sure, we can talk a little more about it. We have worked with our IT department for several different CCBHC projects, and one of those was identifying veterans. So one of the first things we looked at was what were we already collecting, and that was that ANSA and CANS assessment that we collect for all of our clients when they do their initial intake assessment. So we were able to work with IT on having the veteran specific or military specific question that is included in that assessment get flagged so we could pull it into a report, which is our weekly veterans report. There is also, someone had said in the chat about the SDOH, social determinants of health, and or detriments of health, sorry. And that is part of the quality measures that the CCBHCs had just done for 2025 reporting. And I believe they are working to encourage the states to continue, I believe, either developing from that kind of, I know Indiana is a demonstration state, so they are in year 2 of their 4-year on that. So those are continuing to grow, but again, working with our IT closely to figure out what were we already collecting that we could flag that was accessible within our EMR that was already there, and then what did we need to build that maybe was missing. And that can be too where Dwayne has in the toolbook about ask the question. So even looking at if you are adding to your assessments or your EMRs, there's some very specific wording regarding, asking about military and veteran status.
Thank you so much for that. I appreciate that. Paul, I wanted to kick a question over to you in terms of, there was a question that came into the Q&A about, do you have to be a veteran to work with veterans? And, again, with the one-liners that are sticking in my head with you today, Paul, I think that you said that you don't have to be a veteran, but you do have to know about the veteran experience. So Paul, I was wondering if you wanted to share a little bit more. You did highlight a couple of resources like PsychArmor, but wondering if you had other thoughts on resources that could be effective to learning more about working with veterans. And that question could go either for Paul or for Dwayne.
I think one of the beneficial ways to do it is if you do not have clinicians who are veterans, much as like Chrissy and Kayla, they partnered with James, their veteran career coordinator. So veterans with lived experience in some format, either as peers or as caseworkers or case managers, and really engaging with veterans. I think one of the things that, again, that Paul had mentioned was that can I trust you? Working with peers who are veterans or even clinicians who are veterans is a way to offload that trust. I trust the peer and the peer trusts the clinician, so I can then therefore trust the clinician. So I think that's really a beneficial way to be able to develop some more military and veteran understanding. The other thing I think is again, as Paul mentioned, PsychArmor, the Center for Deployment Psychology. I know that we mentioned the STAR Behavioral Health Training Program and the Strong Start Training Network. Both of those organizations, along with having providing some clinical training in the higher levels, also do provide some training on military and veteran experiences. And the Center for Deployment Psychology, Department of War. There's a lot of different programs out there to be able to provide some providers some basic understanding, even some advanced understanding on the lived experience for service members, veterans, and their families.
Thank you so much for answering that from your perspective as a veteran as well. We can go to the next slide. Really appreciate the time that our presenters have taken to walk us through this toolkit, as well as for Kayla and Chrissy for their services within their CCBHC in Indiana, and for Paul and Sarah for the work that you all are doing at the state level in Texas. We had some really quick presentations with that 30,000-foot lens of your work, but we're really happy to announce that we will have an additional learning community series that is coming up this summer, and you'll see an announcement for this soon. During each of these sessions, each of these presenters will have their own bucket of time where they will go into more detail about their programs. They'll also have an opportunity to engage in more interactive discussion and Q&A with folks who are doing the work on the ground. Those who attend will also have, opportunity for discussion with one another and talking about how they're navigating within their own spaces in the field. So keep an eye out for that announcement as well. We do keep those sessions a little bit smaller to allow them to be more interactive. So be on the lookout for sessions 1, 2, and 3 with more information. Next slide, please. We are also in the process of a webinar series focused on information out of the RAND Corporation, 6-part webinar series focusing on their research on the military and veteran community. There's a QR code there where you can register for that current webinar series as well. We just have 2 sessions remaining, but when you register, you'll have access to the recordings for the previous sessions, which have really great information on how to turn that research into impact. Next slide, please. If you are not currently subscribed to the Topics in the News, which is the newsletter for SAMHSA's SMVF TA Center, you may register for that newsletter there, which comes out monthly, and we also have e-blasts for current events. Just want to thank you all again for taking time out of your busy schedules to attend this webinar and learn more about how CCBHCs and other community-based behavioral health programs can serve the needs of service members, veterans, and their families. And thank you so much to all of our presenters who carved out time to share your subject matter expertise and your knowledge, both on this webinar and in the future learning series that is to come. Thank you again and have a great day, everyone.